There are a few other vaccines which are not mandatory but are usually recommended and sometimes optional. One of this vaccine is Japanese encephalitis. So there are certain areas in India, especially the southern areas and the eastern areas, where Japanese encephalitis is very common. In that case, we do use Japanese encephalitis vaccine to prevent this horrible disease. The other vaccine that we look at is pneumococcal. Now, these pneumococcal vaccines are different from the pneumococcal vaccines that we give at birth and in infancy. This is a 23 strain pneumococcal vaccine. This is usually given to children who are undergoing specific procedures like cochlear implants. Meningococcal vaccine is another vaccine which is recommended. Fortunately, we do not have a lot of meningococcal disease which causes meningitis in adolescents. However, when you're traveling abroad, the student definitely requires a dose of meningococcal vaccine because dormitory meningococcal infections are very common. One needs to understand that there is an exhaustive list of vaccinations available, and it is good to reach out to your local pediatrician to understand which vaccines are absolutely mandatory, which are recommended, and which are optional. Towards the end, I would like to talk about some special vaccines which have gained a lot of importance in the last few years. One of them is the flu vaccine. It is now recommended that we get an annual shot of the flu vaccine because the strain of flu almost every year changes in pattern. So to get the latest pattern, whether it is the southern hemisphere or the northern hemisphere, we do tend to advise an annual flu shot, and this is not restricted to any age. Children as well as adolescents, adults and the elderly, all of these would benefit from an annual flu shot. So the other vaccine we are going to talk about is the human papillomavirus vaccine, also known as the HPV vaccine. This prevents HPV infection, which is considered to be one of the major causes for cervical cancers in women. So young women starting from 10 years of age and going up to almost 40 or 45 years of age merit this vaccine. There are 2 or 3 doses depending at what age we administer this vaccine. In some countries, both the boys and the girls can get the same vaccine because HPV is known to transfer from one person to another. Hence, it is advisable that either the boys or the girls, both of them, do receive the same vaccine to reduce the incidence of HPV.